Okay, so the topic of today's car ride is injuries. Specifically, I want to say injuries with basketball, but those are not the only sports in which, or only activities in which there are injuries. So we're going to talk about some injuries, and we're going to do it in a very safe manner, hands-free. Um, and so here are my thoughts. Injuries. For the most part, most injuries are preventable. All right. And the preventable injuries are usually due to fatigue or overuse. One of those two things are likely the culprit for an injury, for preventable injuries. So now, how are these injuries preventable? And before I go, because I know there's going to be some people that are like, I already know this. What are you talking about? I know how to stop injuries. Who are you talking to? I'm not talking to you. If you already know this, I'm cool. That's good. I think that's fantastic. So you should probably tell other people, hey, this is how you stop injuries. But I'm talking to the person that hasn't heard this before, that doesn't know how to prevent injuries and needs some information, some advice on how to do it. So that's the person that I'm talking to right now. Okay. So for those that don't know, I would like to confess. Oh, for those that don't know, I'm a strength and conditioning coach. I've done it for, I don't even know, over 10 years for sure. And I've seen a lot of injuries, a lot. Lots of them are preventable. For the most part, the majority of them are preventable. I've had to help people recover from injuries. I've had people that were injured and we had to modify programs to help them get back to playing shape, to get them back to just being a normal living adult. Hey guys, what's up? So whether it be a broken bone, a torn ligament, strain or a sprain, or anything else, soft tissue. I've had to prescribe exercises. I've had to modify exercises. And I've had to manage workouts. Excuse me. Oh wow, she called me. Called me. Okay. Okay. So anyways, let's see, how many hours without stealing? Sure. Okay. So I've seen a lot of injuries, is what I'm trying to say. And so there have been a variety of patterns that I've noticed with people that were injured. And here are some of the patterns that I've noticed from people that have been injured. One, they procrastinated physical activity. We're talking about athletes, right? They procrastinated physical activity. So let me tell you a little story. I was working with the soccer team. They obviously wanted to win, and so I put together a program for them to do in the off season. I go to the meeting, end of the season meeting, right? I have the program in hand. I say that, hey, I don't have it in hand. I don't think I had it in my hand. But I said, I'm going to send you a program. It's going to be 16 weeks. This is what you have to do. You're going to start that once you get home. Okay, cool. Everybody was in that meeting. Everybody understood. I asked them if they had any questions. Cool, got it. 2 weeks before preseason starts. 2 weeks before. Oh, should I have started the program? I don't know when you're supposed to start a 16-week program that's supposed to happen over the course of the summer. You start it before the 16 weeks are up. That's when you start it. So don't procrastinate your training, right? I've had some coaches, a lot of basketball coaches that say, hey, my athletes are just gonna play themselves into shape. Play yourselves into shape? First of all, what the hell does that mean? What does play yourself into shape mean exactly? I've never really understood that. If the goal is to run faster, if the goal is to jump higher, if the goal is to not be fatigued while you're playing, to improve your performance, why would you play yourself into shape? And how the hell would you play yourself into shape without suffering some kind of overuse injury? Because that's literally all you've done. You've played in the off season, you played in the preseason, you played during the season. At what point are you going to train the muscles that you don't use during basketball? Is it just going to magically not cause a problem? Is that what's going to happen? And so, like, sometimes I stare at coaches when they say stuff like that, and I'm thinking, okay, please help me make sense of this. So don't procrastinate training. Start on time. You don't have to do a lot. You don't have to work out 5 days a week. You don't have to be on the treadmill for 2 hours. You don't you don't have to stay in the gym for 2 hours. You just need to be consistent, and you need to start early. If you can start early, the 1 week or 2 weeks after the season ends, start your training, you're golden. And it doesn't have to be a super intense program. You just need to make sure that when you're training the muscles that don't get used during the basketball season if you're a baller. If you're playing soccer, American soccer, American football, or, European football, start early and train the muscles that don't get trained in addition to the muscles that do get trained. If you can do that, that'll increase your chances of not getting injured. Like, when it comes to sports, your ability to be present, to be available, is far more important than your ability to, do a ton of push-ups or pull-ups. And I don't want to minimize training for training's sake, but I do want to minimize the fact that some people think that they have to do what somebody else has done in the off season to warrant training. You need to have big muscles. Well, that's not true. You need to be able to jump out of the gym. No, but you need to be able to jump higher than you did before, or at least be able to do that amount. Now, notice I said at least. But anyways, I went off on a tangent. So, procrastination. That's one way to get injured. Okay. Next way you get injured, I kind of alluded to it before. Overuse. Doing the same repetitive action over and over again in an effort to improve also burns the candle at both ends. The tissue that you're using to get better, if it doesn't have time to heal and recover, now that tissue's compromised. Now the risk for that tissue to get injured is now higher. And I get it, the goal is to improve. I understand that. But you can't improve if you're hurt. If you got an injury from working out, from training, that defeats the purpose of the training. The training is to keep you from getting hurt. The training is to help you improve. You can't improve in an injured state. And so you have to find and strike a balance. Whatever you decide to do from a training perspective, if you can't heal from that, if you can't heal the body, if the body can't physiologically recover, I think I can do this. I believe I can do more bench press. I believe I can do more jumping. I believe I'll be fine. I believe that I won't get injured. It's not about what you believe. It what matters is most of the people that got injured, like Kid Hutchinson for the Detroit Lions, I'm sure he believed that he wasn't going to get hurt. Fast forward, he's got a broken lower leg, completely broken, like that. I'm sure he believed he wasn't going to get hurt. I'm sure the coaches believed he wasn't going to get hurt. I'm going off on a tangent. I'm getting a little worked up because I don't like when coaches inject themselves into training when they shouldn't, because they don't physiologically understand the body and how it works. And when people start to just arbitrarily pick exercises and volumes that they shouldn't be doing. So stop being super specific with your training and choose some training methodologies that allow you to heal, to do better, to improve. That's what's important to me. Too specific, too much volume, too short of amount of time. That's the next one. Trying to make up for lost time or just trying to get better as quickly as possible will leave you injured. Again, your tissue, your bones, your connective tissue, it all has a tolerance level. Imagine a cup, right? That cup has a fixed amount that you can put into that cup. Your bones, your tendons, your ligaments, every other piece of tissue in your body is a cup. It has a tolerance for a certain amount of trauma and stress. When you exceed that, that's when the injuries happen. That's when the overflow happens. When you train, you can make your cup bigger, but it takes time and it takes being intentional and it takes recovery for that cup to get bigger, not overflow. Train to the point where you get to the point where there's a lot of water in there, but it's not overflowing. Then the cup gets bigger, and you do it again. Then the cup gets bigger, then you do it again. All right, I'm all done. But if you have questions about exercise, shoot them to me in the comments on this video, or you can shoot them to me directly. To prevent injuries, all right, I usually don't make complaints unless I can do something about it. If you look in my bio, you'll see a link for a training program template that helps you plan out your workouts, and also it can help you plot out where there's increases in volume. You can track your volume, you can track your improvement, you can track your progress. Take that, go to that link, take it, give it to somebody else. It's free. I made it because I'm actually using it myself with the sports teams I'm training over at the high school down the street. And so please use it, give it to somebody else, and best of luck. Take care, guys.